Hello, welcome to my channel. My name is Rumby. I'm a qualified ODP and I'm currently practicing in anesthetics and recovery. So basically, I just want to talk about what an ODP is and how the training goes and what has been my experience so far being an ODP. So if you do decide to study ODP, the most asked question you will get is what is an ODP? And this will come from other healthcare professionals. This will come from patients, and even your family members will ask you. So it's good to know the definition of what an ODP is. So ODP stands for Operating Department Practitioner, and operating department practitioners are part of the allied healthcare professional. So they work alongside other healthcare professionals, but mainly in theatre, and they make sure that the surgery happens successfully and it's safe. So ODPs, they work in three roles. So they do anesthetics, which is before the surgery, so putting the patient to sleep, getting the patient ready for the surgery, and they do scrub side, which is intraoperatively, so you're helping during the surgery, and they do post-operatively, which is called recovery. This is when the surgery is finished and the patients, they go there before they go to the ward. So I want to talk about the three roles. I'll start talking about anesthetics. So currently I am working in anesthetics and recovery. Anesthetics is one of my favorite ones. That's just my personal choice, but all the roles are just as important and they're quite enjoyable. So anesthetics. So what does an anesthetic ODP do? So an anesthetic ODP's role is basically you're in charge of getting ready all the equipment for intubation, getting the patient ready for the surgery. So the setting procedures we do in the anesthetic room. So depending on the kind of surgery the patient is having, so we might do some spinal anesthetic. So that's the injection in your back. We might do some epidurals, intubation, so getting all your intubation stuff ready. And you work with anesthetist. And during this time in your anesthetic, you work with anesthetic consultants, you work anesthetic registrars, and you work with other junior members as well. And another thing, what you're in charge of is your drugs. So you have to you have a CD key where you're basically keeping safe the controlled drugs. These are quite heavy drugs, so they need to be controlled, and we need to keep account of how much we use and when did we use it for which patient. And also you need to know your emergency drugs, because a lot of emergencies that happen in theatre, other than what includes the surgical field like bleeding or something, it's mostly the anesthetic part. I'm not saying there's no emergencies in the scrub side, but most of the emergencies, anesthetics, you're very involved in the emergency. So you're in charge of your drugs, you're in charge of fluids for the patient, monitoring of the patient, and assisting the anesthetist with intubation. Then we have the scrub role. So the scrub role mainly involves you anticipating the needs of the surgeon. So you do your preparing your kit before the surgery, and this is something we discuss in the WHO, with it, which is basically like the team brief in the morning. This is something we discuss that we're going to be doing this surgery and we're going to be needing this kind of equipment. So you get your equipment ready, and it's very important to know the surgery and know the steps of the surgery, because obviously if something happens, you need to know what your surgeon is going to need. And also you can be circulating as well. That's one thing I forgot. So there will be a scrub, someone who's scrubbed, so that's the one who's actively helping the surgeons. And then there will be some people who are circulating. So what do we mean when we say circulating? So when we say circulating, you're not scrubbed, but you're helping the scrub practitioner or the scrubbed ODP with all the equipment they need. It might be sutures, it might be washouts, it might be any kind of equipment they need. So you need to know your equipment very well. You need to know the kind of surgeries you're involved in, and you need to know the steps of the surgery. So anticipating this the needs of the surgery. And also another thing is keeping the sterile, if you're in scrub side, keeping the sterile field, because obviously infections are very important to make sure we keep the infection rate very low. So you're in charge of making sure that there is no cross contamination between the clean surgical equipment and everyone else, basically. And also we have the recovery, which is basically, you might hear some places will call it recovery, some places will call it PACU. So PACU stands for post anesthetic care unit. So this is where patients go after surgery, because they might have had a general anesthetic, they might have had spinal anesthetic, they might have had a big surgery. And if you think about it, on the ward they do 1:6, one nurse per 6 patients roughly. So if they have an immediate post-op patient, they won't be able to look after them properly. They won't be able to do one-to-one. So that's why we keep patients in recovery before they go to the ward. And your role in recovery is to make sure that the patient is hemodynamically stable, so making sure all the vitals are fine and stable, making sure the drains, there is no blood draining out, and the dressings are clean and dry, making sure they can breathe for themselves properly. So in recovery, it's very, very important to know how to assess your patient, to know how to deal with emergencies. So things like anaphylaxis, things like airway obstruction, is very, very important. Recovery is very, very good, and it goes well with anesthetics. But yeah, that's what you do in recovery. So the ODP training. So, well, the ODP training, you have a choice. There is the 2-year diploma course, and then there's the 3-year degree course. However, the HCPC is trying to phase out from the diploma course, but we still have people who have done the diploma who are still working as ODPs. And I think in some places they're still offering the diploma, but I think from 2024, you have to do the degree. So 3 years. So I did the 3-year course, the degree. Just I just wanted to do the degree. So in my course, I had the first year where we had placement quite early on, which I did like because it was early patient exposure, and I learned a lot, to be honest. I loved my first placement. I loved my first mentor. She was very, very nice to me, and I learned a lot from her. So I had vascular for my first placement. I was doing anesthetics and scrub, and it went really well. We had a first month of teaching. Then that was September. Then in October we were straight into placement, and we're doing about 24 hours a week, but we were also having lessons during those weeks as well. And the term time kind of runs, it depends with the university where you were. Where I was, it was from September till June, late June, and then from July, August, you have your holidays. Then I had second year. I had general surgery, I had urology, and I had just some acutes, which is basically like emergencies, so a bit of everything. And also did recovery during my second year. So that was quite a good variety. I did scrub anesthetics and recovery. Then my third year, I did emergencies acute. So in my uni, they wanted to make sure that during your 3 years you have at least exposure to emergency surgery, so you kind of see how the lists are run, because emergencies is kind of different to how normal theaters run. Because in emergencies, the list changes anytime depending on what emergency is there and the priority of the emergency. But in, like, let's say you have an orthopedic list, you discuss your list in the morning, and we kind of follow the order of the patients we discuss in the morning. But in acute is a bit different, or emergency is a bit different. Yeah, so I did have a good time. I learned a lot. It was difficult because there were a lot of hours. I think in my third year we're doing 30 hours a week, and we still had lessons as well. So I did find it difficult towards the end, just because of the time in the assignments, and it got a bit overwhelming. But overall, it was very, very enjoyable. I had a good time, and I would definitely recommend ODP. Definitely, definitely. I'm enjoying myself. I've learned so much. I've met some amazing people, and I'm quite young, so at work I always have people who look after me. Like at my work, I can vouch for them. They're all very nice. They look after me. Everyone's always checking on each other, so you're part of the team. Is very nice. However, one thing I want to point out is basically in theatres we don't only have ODPs working. So you're working with anesthetists, you're working with surgeons, you also have nurses, we also have radiographers, and theatre support workers. So because ODPs, there is a shortage, so sometimes nurses, they do come into theatre, they will get extra training because they're not specialized in theatre. However, ODPs, when we graduate, we can work straight into theatre. but for nurses, they will get extra training to work in theatre. So my experience so far, and where I am now. So right now I am about 2 years post qualification. I work in anesthetics and recovery. So basically, the way my hospital works is, if you're in anesthetics, you do rotate all the specialties. There is no the orthopedics team or the trauma team or the spines team or the general team. You just basically, if you do anesthetics, you do anesthetics for everything. If you do recovery, you're recovering everyone. So I do anesthetics and recovery. I'm loving it. At my work, everyone is really nice. Everyone looks after each other. It's a really good working environment. I feel like there's opportunities. This is why I wanted to go in a big center, because I don't want to feel limited. I want to learn more, and I feel like my workplace has really provided that for me. So that I do like. I am also doing a postgraduate course as well. So I'm currently studying and I'm working as well. So I work part time at my work, and I'm studying full time. And that's all. Thank you.